So, what is the central pain, chronic pain, and claudication pain? So, the central pain, as you can see, is the pain caused by a lesion or disease of the central somatosensory nervous system. Central pain is usually associated with abnormal sensibility to temperature and to noxious stimulation. So, normally, we have some damage in a periphery of our organs, let's say, for example, our limbs, our internal organs of the stomach, of the chest, things like that. Internal organs may be not as frequently, but generally from our skin and things like that. But in case of the central pain, pain is caused by a lesion, for example, stroke, of our central somatosensory nervous system. So our central nervous system is affected and it causes a pain. This is a very bad situation because it's very hard to treat such pain. A lot of mechanisms of modulation, of inhibition of transmission, of transduction would not help here. So the central pain is when it's related to central nervous system. The chronic pain. The chronic pain is pain that persists beyond the course of an acute disease or a reasonable time for an injury to heal, or that is associated with a chronic pathologic process. Some investigators use just the time number, yes, that when it's above 6 months to designate pain as chronic. Because sometimes it's hard to say whether the pain is already chronic or not. If, for example, you would break your hip and after a couple months it's still painful, let's say 3 months it's still painful, it may be still normal. But if you would bruise without any fracture your finger and after 3 months it still would be painful, something is wrong. Yes, so generally this first part tells everything. So when there is a still pain after the time that it's reasonable to think that it will be healed. Yes, so after, for example, after we have some small cut on the finger, reasonable time to heal it is couple days. Yes, it can itch for couple days more, but after 2 months there should be no problem. Yes. So if such reasonable time passed and pain is persisting, this is a chronic pain. Or if anything generally, in any situation, the pain is lasting longer than 6 months, it's also pathology. Okay, and claudication pain. Crampy, achy, lower extremity precipitated by ambulation activity, caused by vascular insufficiency. This vascular insufficiency is critical for this definition, so we have some blood vessels, yes? Blood vessels are critical to get nutrients into the body, yes? So when we have, for example, because claudication is mainly in the lower limbs, when we have some problem with the blood flow, yes, some blood clot, for example, in arterial veins, in a lot of veins, but never mind. It's mainly connected with the arteries. So if the blood flow is reduced, the tissues in the foot, for example, in the lower limb generally, will have less blood, yes? They would start to die, yes? So we have a tissue damage. If we have a tissue damage, it will lead to pain. And it's precipitated by ambulation and activity. Why? Because in case of the activity, muscles are using more energy and oxygen. So if not enough oxygen and nutrients are getting into the muscle, and muscles are using them even stronger, it would lead to even bigger pain. Yes. And there may be also neurogenic claudication caused by some problems with the afferent nerves, like in case of the diabetes. And there may be some significant central spinal canal stenosis. But generally it's usually connected with lower limbs. Of course it's possible everywhere theoretically, but it's usually lower limbs, and usually with the problem with some severe problem with the arteries. But of course not only. Okay, thank you very much.